Hi, I'm Alison Gustafson, the Director of the Food is Health Alliance, and I want to speak to you today about a serious health crisis that's occurring in our state and across the country: food insecurity. The Food is Health Alliance at the University of Kentucky is working to address the issue by connecting clinical and community partners, along with managed care organizations, through a variety of pilot programs across the state of Kentucky. In this video, you will learn more about the process of screening for food insecurity and the steps you can take as a healthcare provider to best assist patients experiencing it. To begin, food insecurity has several formal definitions, but in practice, it refers to the inability of individuals or families to consistently afford and access enough safe, nutritious food to live a healthy life. Food insecurity affects millions of people nationwide and approximately 600,000 in the state of Kentucky, or about 13% of the population, which is much higher than the national average. Certain populations are more likely to be impacted, including households with children, minorities, rural residents, and the elderly. Food insecurity has been directly linked to a wide range of diet-related chronic conditions, including obesity, type 2 diabetes, cardiovascular disease, and certain cancers, along with poor mental health. Patients experiencing food insecurity are often forced to choose less costly, calorie-dense, nutritionally inadequate foods like fast food, snack foods which are highly processed, and other items that are high in sugar, salt, and saturated fat. They may also skip meals or be forced to choose between food and other necessities like rent or electricity. Studies have shown significantly higher rates of diabetes in food insecure households, and food insecure patients with diabetes are shown to have worse glycemic control, increased markers of high blood sugar like hemoglobin A1C. Similar outcomes are seen with other diet-related conditions like heart disease. So what can you do as a healthcare provider? It can be difficult to know where to begin or how to best help your patients once a diagnosis has been made. One of the biggest challenges facing practitioners, researchers, and government agencies trying to tackle the issue of food insecurity is the lack of consistency in screening, documentation, referral, and then follow-up. Healthcare providers can have a major positive impact by screening patients for food insecurity and referring them to services where they can find assistance. To get started, an easy screening tool you may want to try is the validated Hunger Vital Signs Screener. This simple tool is a quick 2-question survey that can be given to patients in a clinical setting. The survey asks the following. 1. Within the past 12 months, we worried whether our food would run out before we got money to buy more. And 2. Within the past 12 months, the food we bought just didn't last and we didn't have money to get more. If a patient answers sometimes true or often true for either question, then he or she qualifies as food insecure. This question can be asked face-to-face, but there's some evidence that patients will answer more honestly if they were able to respond via a written or digital questionnaire. There is still a great deal of stigma and sometimes embarrassment around food insecurity, so it's important to approach this situation with empathy, sensitivity, cultural consideration, and care. Toolkits and other resources for learning to screen for food insecurity are available at hungerandhealth.org and on the Food is Health Alliance website. Once screening is implemented as a part of standard practice, it's important that healthcare facilities adopt a consistent method for documentation. Recording the diagnosis in a patient's electronic medical record, or EMR, is a critical first step. The Gravity Project is a national nonprofit working to help healthcare facilities implement screening and documentation practices for social determinants of health, like food insecurity. It can be a great resource when your facility is first getting started. At your worksite, you may find that there is a social determinant of health tab in the EMR. You will find the Hunger Vital Signs Screener questions sometimes on the EPIC system. There are other ways individuals at your worksite may be advocating for the screening process to be implemented. The key takeaway is to know this process will change in 2024, and you may need to have a training on how to screen your patients based on your workplace policies and procedures. In the next video, you will learn more about what the Food is Health Alliance is doing with managed care organizations, community groups, and certain entities at your workplace for referring patients into appropriate food as medicine packages to combat food insecurity and diet-sensitive chronic disease. For more information on the next steps you can take after screening for food insecurity, be sure to watch the next video in this series.